It is a new year, a perfect time to start fresh and focus on our health and well-being. So with us today to share ways to help you and your family have a healthy 2026 is Dr. John Redding with Cone Health Primary Care at the Medcenter in Asheboro. All right, let's first and foremost talk about what's the number one item that should be on everyone's checklist.
Thinking about getting a good annual wellness exam with their preferred primary care provider.
Yeah, and sometimes that can be a little difficult because sometimes people don't have a primary. So what kind of recommendations can you give us to how we can get one of those ones? What's the best way to look for one?
Well, there's any number of ways that folks can obviously talk to family and friends. Cone has a website, conehealth.com/primary care, that could also be useful. And so just one of the resources available for folks to consider.
Yeah, I know years and years ago, it was hard to get a primary caregiver because people weren't taking new patients, but now that seems to have lessened. So we need to check those websites again and see who's got some space available for us. Let's talk about some of the health screenings and tests that we should be talking about with that new provider when we get them.
Well, the annual physical or annual wellness exam is an ideal opportunity for us as providers to really get to know our patients, which is invaluable in high quality care. Obviously, it'll depend on the age of the patient, the individual needs. From our standpoint, when we get into a wellness exam, we're going to go through the past medical history, which in some cases, especially with older folks, can be extensive and it requires a good bit of study. But once we get to know that situation better, it can be invaluable in focusing on the things that are especially important. We're going to go down the med list with a fine tooth comb. We're going to get into lots of information about their close blood relatives that are going to be important. We're going to eventually, at the appropriate time, check labs, get an idea about all sorts of things related to cholesterol, blood sugar, prostate cancer screening in men, and the list goes on. Might want to get into some colon cancer screening, incredibly important. And also breast cancer screening. When was the last time a particular woman had a pap smear? All those kinds of incredibly important cancer screening things that have to be addressed periodically.
And just because you look at someone and they look healthy or they feel okay doesn't mean that everything's okay. You actually have to do some of those screenings in those labs.
You got it. It's actually pretty common to see a relatively young, healthy person with, real problems as far as cholesterol or blood sugar, and they don't necessarily realize it. And the other one that's really sticks out is blood pressure, typically in adults. There's a reason they call blood pressure the silent killer. There's a lot of folks out there with poor blood pressures who don't realize it. There are people who feel poorly with elevated blood pressures, but a lot of folks don't. And that's one of the best examples of something sneaky that can be certainly picked up in a wellness exam.
You think to yourself, I feel great and I look fine. Nope, you need to go see the doctor. All right, so in addition to those health screenings that you just mentioned, let's talk about some vaccines and some other things that we need to make sure that we're up to date on.
You bet. Vaccines are very important from our standpoint. Obviously, everybody has to be taken individually. There are some folks that just can't handle certain vaccines, but in our experience, these vaccines are very important for the vast majority of folks. Obviously, a lot of folks need their flu shot in the fall. We also want to focus on things like the pneumonia vaccine. We see a lot of pneumonia, mostly in adults, but sometimes in children as well. And certainly we can significantly reduce the risk of getting it, as well as if they do get it, reduce the very significant risk of hospitalization or worse. And so those vaccines are incredibly important. Obviously, COVID boosters, and there's just a pretty long list of other possible vaccines depending on who the patient is, what their specific needs are, et cetera, et cetera. And certainly advocate that in the vast majority of folks.
Sure. Okay, so we talked a lot about our health, as in our physical health. Let's talk a little bit about our mental well-being as well. What steps should we be taking when it comes to taking care of our mental health?
Mental health, we do depression screenings fairly commonly here so that we're looking for it, even if it's not something that you necessarily are immediately comfortable speaking to the provider about. We also want to see how you're sleeping. We want to talk about sometimes dynamics within the family, if you will. And then that also goes back to the social history. How are things going in the realm of tobacco and alcohol? Obviously, alcohol can be a very significant depressant in some folks and is clearly a bad idea for some folks, and it will certainly mess up your sleep cycle. So all that, will be covered.
All right. So we're going to continue on because we want you to have a healthy new year. We'll be back in just a few moments.